So let me begin. Let me begin with a couple of introductions here, everyone. I do have Mayor Pro Tem Blackburn. You can give a little wave, Mayor Pro Tem. I'm going to turn it over to you here, just to bring a few greetings, representing District 2 today.
Thanks, Kim. Welcome to our town hall meeting to share ideas on homelessness. It used to be that traffic issues were the big quality of life conversation I would have with residents. Unfortunately, it's now been replaced with homelessness and the quality of life issues it presents to both our residents and those who find themselves homeless. The solution isn't easy. If it were easy to solve, we would have already solved it. So thank you to our staff, our police department, and all of you for spending tonight with us to try to share ideas and suggestions. So I'm not going to take up a lot of time. So I thank you, Kim, for helping facilitate tonight's meeting.
Excellent. Thank you so much for that welcome. I have a few more introductions, everyone, just to let you know who's here joining us on the call. A couple of people that I'm going to get to do a wave. You're going to be hearing from them much more as we go forward this evening. So a couple of people I wanted to introduce you to. Holly Nelson, everyone, is our Senior Homeless Program Manager. Holly, if you just want to give everybody a wave, you're going to be hearing from her as we go forward. You're also going to be hearing from our Assistant Police Chief, Mickey Williams. Mickey, I believe that you're here as well. Excellent. We also have our Housing Services Manager, David Corderova. David, I practiced so many times and I made a mess of it one more time. My sincere apologies. I will do better. I will do better next time. And then you will also see, everyone, that we have a series of other city team members here as well that are going to be serving as note takers and timers and that sort of thing. Any of you who've participated in online meetings know that it takes many hands to make all of this technology go around. And then everyone, just one more time, my name is Kim and I'm going to be serving as your host this evening. Now, everyone, I don't work for the city. My job here very much is to support a really constructive and a really productive conversation. We know that talking about homelessness, this is a really complex topic and people have different experiences and they have different perspectives on what needs to be done and how it's being done. And so very much it's my job tonight to ensure that everyone who's here gets as many opportunities to participate as they can, and also ensures that everyone here continues to feel safe and comfortable participating in the ways that make the most sense for them. So here's a little bit, I'm going to talk just a teeny bit more, everyone. And then I promise I will be stopping talking soon and turning it over to some of our team members. Again, tonight, everyone, is about a few different things. We're going to be sharing with you some information about what is the city already planning related to initiatives to reduce homelessness. This is also an opportunity for community members to share with us impacts and ideas and perspectives. And this is also an opportunity to ask questions, and to, as much as possible, we're going to answer as many of those as we possibly can. So again, everyone, I encourage you to share lots. We're going to make sure that we have as many opportunities to hear from you as possible. And I encourage us to be really respectful and really constructive with one another as we go forward. So let me give you just a little bit of a Zoom tutorial. I know that some of you have probably spent many hours on Zoom and feel really comfortable in this space. For some of you, this might be a very first time on Zoom. So I did want to give just a little bit of a technology overview before we get going. So a couple of things that I want you to pay attention to. In your top right-hand corner of your Zoom screen, you're going to notice the word view. You can change it so you can see a speaker view, or you can see gallery view. This sometimes helps people when they're listening. So again, top right-hand corner of your screen, you're normally going to see something called view. You're also going to be able to turn your cameras on. You can also turn your cameras off, and you're going to find that in the bottom toolbar. If you're using a desktop or a laptop, again, you're looking for a toolbar. Some of you might be joining by a smartphone or a tablet. In those cases, you might have to do a little bit of swiping back and forth on your screen in order to find some of these different features. We do know we also have a couple of people who are calling in by phone, and you're going to be looking for *6 in order to mute or unmute yourself. And we'll let you know when it's time to do that. And the last thing I need you to know about related to the Zoom technology, because we want to have an open discussion tonight, we're going to be using something called the raise hand feature. And this is where you're going to raise an electronic hand, which is going to indicate to me that you've got a question or you've got something that you would like to share. So let me tell you, everyone, I'll remind you again when the time comes, but where you find that feature. Again, you're looking for a toolbar. It's generally black, and it's generally along the bottom of your screen. And you're looking for the word that says reactions. In that word reactions, you're going to see something that says raise hand, everyone. Now, again, I'll come back to this again in a few moments, but just wanted you to have a chance to dig around into some of the tools so that you knew where some of those things are. Okay. So I got a couple of questions, everyone, to get us warmed up and get us sort of thinking a bit about our conversation tonight. So what you can expect, everyone, we're going to have just a brief introduction here. I'm going to get you talking. We're going to use that chat box a little bit, kind of get us warmed up. I'm going to be turning it over to Holly here in a little bit. She's going to provide an overview to some of the work that the city has already been doing. And then we're going to open it up for discussion, everyone. We've got quite a bit of time for comments and for questions. And then we're going to, as we get to near the end of the session, we're going to come back all together and we're going to do a bit of a moderated panel discussion where I'm going to be working with Holly and with Mickey and with David, and they're going to be answering a number of the questions that were raised. So again, a few questions to get you started, a bit of a presentation, a little bit of an overview, lots of discussion, and then some answering of questions at the end of the session. And we are going to do our best to make sure that we end at 7 p.m. when we had committed to. Last but not least, Sarah. Sarah is our tech support person, everyone. If for some reason you are struggling with any of the technology, she is going to put her phone number in the chat right now, everyone, and you can give Sarah a phone call. It's a local number, and Sarah is going to do her best to make sure that you've got all of the technology support that you need. So you should have seen that pop up in a chat box, everyone. Sarah is her name, and there is a local phone number there that you can give her a call if you're struggling with any technology. Okay, so I have a couple of questions for you, everyone, to get going. Margaret, if you could bring up a first slide for me, everyone. We've got 2 questions, and we'd love for you to share some of your responses in the chat with us, everyone. So right now in the chat, could you share with us what's one thing that you know for sure about homelessness in Carlsbad? We know there's a lot of experiences. We know there's a lot of differing perspectives, but what's from your experience, what you know, what's one thing you know for sure about homelessness in Carlsbad? I'm just going to give a few moments because you can see that lots of people are starting to put some responses in there. Excellent. So we've got people saying that we do know that it's increased. We do know that people are feeling potentially feeling unsafe. Yes, lots of people saying it's increased. The majority of people who are experiencing homelessness are from Carlsbad. Haven't seen so much of this anymore. Lots of people saying that it's increasing. People sharing that they're seeing it in their neighborhood. Excellent. Thank you, everyone, for sharing. Some people saying due to lack of affordable housing, also potential impacts related to mental illness. All right, so I have another question for you, everyone, again, to start getting you thinking, start getting you reflecting on this. Margaret, if you could bring that next question for me. Here's the other thing that I'd like you to share in the chat box, everyone. What's one thing you're uncertain about? So we asked you, like, here's one thing, like, what's one thing you know for sure? On the flip side, what's one thing you're uncertain about related to homelessness in Carlsbad? So again, looking for you to type in the chat box, what's one thing maybe you're uncertain about? All right, so some people sharing like, I don't know what the solution is. I'm not entirely sure how to make it better. What's causing the increase? Like where is this coming? Where is this coming from? So lots and lots of different uncertainties related to this. So thank you, everyone, for and there's lots more messages coming in here. Some people uncertain about what's the city's strategies, uncertain of how it is that we are going to move forward. So thank you, everyone, for sharing some of these ideas here in the chat box. This gives us a sense of some of those initial thoughts. All right, so I'd like to turn it over, Margaret. We can keep that. Actually, no, let's go like this. I'm going to bring up Holly. I'm going to bring up Holly here first. Now, I'm just doing a quick check. Many of you have just recently joined us and you've been hearing me talk. This is Kim Hishka. Again, just wanted to say a warm welcome to all of you that have been joining us. We're just getting the conversation started here. So don't worry, you haven't missed too much. I will do my best to ensure that you know what's happening as it's happening. So Holly Nelson, as I mentioned before, everyone, she's our Senior Homeless Program Manager. Holly, I'm going to turn it over to you just to provide an introduction and overview, a bit of like set the stage for our conversation. So Holly, turning it over to you.
Thanks, Kim. Hi, everyone. I'm really glad to be here tonight, and I'm looking forward to hearing your feedback. As Kim mentioned earlier, I serve as the city's homeless program manager. I'm a licensed clinical social worker, and my background has been in homeless services throughout my professional career. At the city, I manage the homeless contracts, I design programs, I help with policy, and I work collaboratively with residents, business owners, individuals with lived experience, faith centers, nonprofits, and lots of different community members. So very much a pleasure to be here tonight, so thank you. We heard loud and clear from you that the city needed to work towards a solution to reduce homelessness in Carlsbad. As a result, the City Council made this as one of its top goals and recently approved a comprehensive package of programs designed to make a lasting progress on this complex problem. We want to share a bit more about what those programs are tonight. Like everything in Carlsbad, we want to make sure we do things right and through an approach that we have meaningful, lasting change. We developed a plan that is very thorough and is based on data and research by experts. These new initiatives that we are moving forward are based on best practices for creating long-term positive change. In developing our plan, we've also considered what are the barriers to getting those experiencing homelessness into permanent housing. We prepared a short video to provide some additional background on homelessness in Carlsbad and what we're doing to address the issue.
Thanks so much, Holly. Now I'm just checking, we're ready for the video. Now everyone just give us a moment. There's a bit of technology that needs to happen to make this all go around. So here we go, everyone. This is just a couple of minutes to give you a bit more background.
The city of Carlsbad is committed to making a measurable difference when it comes to homelessness. But the things that work in the long term can also take a very long time. That's why we need a combination of short and long-term interventions. The city has already been working on the issue of homelessness, but a new, more comprehensive plan will increase existing efforts and add new programs that studies have shown effective in other areas. Studies show that the old approach of requiring someone to address their issues first in order to be considered ready for housing doesn't work very well because too many people can't overcome the barriers to getting help. This ends up costing more because emergency room visits increase, as do contacts with law enforcement and the time spent living on the streets. Housing First removes barriers to getting into housing so the person can get access to services as quickly as possible. Having a stable place to live provides a foundation to more successfully address the issues that lead to becoming homeless. And studies show that this approach ends up costing less in the long run. One way the city of Carlsbad is using a Housing First approach is through a 12-month pilot voucher program, partially funded through federal grants. Through this program, certain people experiencing homelessness can stay in a hotel or motel with a specialized program in place that includes these support services. The program will focus on shelter for women and families, individuals living in encampments, people who frequently use emergency rooms and public safety services, individuals with an underlying medical condition, and those 65 and older. The city will also work with the La Posada Emergency Shelter for Adult Men, the only homeless shelter in Carlsbad, to hire 2 social workers and provide training to existing shelter staff so the shelter can lower their barriers and help more people. Another part of the city's program is to quickly intervene when people are homeless. Through a contract with the Community Resource Center, individuals and families will be rapidly rehoused and provided with support services so they can get back into permanent housing. Looking to remove as many barriers to housing as possible, the city will also develop a pilot program with the Humane Society to provide temporary shelter to pets of people experiencing homelessness. Given the complexity of issues related to homelessness, many different parts of the city work on the city's response. A new Housing and Homeless Services Department will consolidate these efforts and increase coordination not just within the city, but with regional agencies and nonprofit groups. In addition to greater coordination among the existing efforts, the city is adding resources where they're needed most. This includes adding 1 sergeant and 2 new officers to the police department's homeless outreach team. The city will also coordinate with the county with their North County Social Worker Pilot Program and the Behavioral Health Outreach contracts. A contracted employments and benefits specialist will help connect people to disability and Social Security benefits, general relief, CalWorks, CalFresh, veterans benefits, stimulus checks, employment programs, and other aid programs. While the city addresses the immediate needs of those experiencing homelessness, we also realize that more affordable housing is needed. The city's recently approved housing plan identifies ways to create more affordable housing and locations where that housing could be built. Finally, to create more opportunities for the public to learn about the city's efforts and provide feedback, as well as check on progress, the City Council created the Homeless Action Subcommittee, which will help ensure the city's programs are meeting the community's needs. Learn more about the city's homeless response plan on the city's website. And thanks for being involved in this important issue.
All right. Thank you so much for everyone for your attention there for a couple of minutes. few things I wanted to let you know about, and then we're going to open it up for comments. We're going to be opening up for feedback here in a moment. There is definitely some questions and some comments that are coming into the chat. Please know, everyone, that we are recording. We are recording those as we go along here. So don't worry, we haven't forgotten any of those comments that are coming in the chat. I also did just want to take a quick moment. I see that Mayor Hall has just had the opportunity to join us here as well. Mayor Hall, if you want to just give a wave to everyone. So thank you so much for joining us this evening. We're just sort of getting started. We've shared a bit of information, and we're opening it up here to some discussion. So thank you for coming and joining us here. All right, everyone. So here's what we want to do. We want to open up the floor so that we have an opportunity to hear from some different people. Let me just do a quick check-in with Holly. Holly, was there anything that you wanted to add before I go into some open discussion?
No, I think now that we have the big picture of what we're doing at the city level, I think we're now very eager to hear the feedback of our community and get your thoughts on our programs and what we can do to support these programs.
Excellent. Thank you, Holly. All right, everyone. So this is here's the best way we can make this work so that people have the opportunity to speak and they have the opportunity to listen. If you're interested, everyone, in coming off of mute, and if you're interested in either asking a question or providing a comment, we want to make lots of opportunity to do that. We're going to just sort of open the discussion here for a period of time. We'll come to the actual staff answering questions at the end. So we're going to collect the comments, we're going to collect the questions, and then we'll get some responses at the end here. So those of you that are interested in coming off of mute and offering, again, comments or questions, I'd love for you to dig around right now and find that raised hand feature. I'm going to see how many people raise their hands. That'll help give me a sense of how much time we have for everyone. Likely everyone, we're going to have about 2, maybe 3 minutes, kind of depending on how many people raise their hand here. Again, if you're not sure where that raise hand feature is, you're looking for the toolbar, usually along the bottom of your screen. You're looking for the word reactions, and you're looking for the phrasing that says raise hand. That will help me know that you said that you would be interested. I believe Zoom makes it easy for us where they come up in the order of people that raised hands. So I'm just going to sort of work my way through the list, everyone. So we're going to, we've also got a fancy little timer here to support us to make sure we're trying to be as fair as we possibly can be. So we're going to set a timer. We're going to invite you to speak for about 3 minutes, everyone. You have the and if you don't use all that time, no worries. But you'll have about 3 minutes, and then we'll move to the next person. And then we'll do another 3 minutes and we can move to the next person. So again, questions are welcome. Comments are welcome, those sorts of things. If you haven't raised your hand yet, but later you've got some questions or later you've got some comments building on what others have said, please feel free. You're welcome to raise those hands at any one point in time, and I will do my best to moderate and circle around. So it looks like we've got a couple of speakers to get us started here. Susie King, you are the first person that hopped up on my Zoom screen. So Susie, why don't I turn it over to you? And we're gonna got 3 minutes there for you.
Well, no, I don't need that much time. Thanks for hosting this. My question, I don't know if this is the right platform or not. What about the volunteering with outreach team that you guys have in Carlsbad? Is that an option to do any volunteer work to help, wherever is needed? So
Perfect.
That's really my question. And again, I don't know if this is the appropriate platform for it, but that is my question.
And Susie, how about this? We're using this as an example for everyone else. We've captured your question right now. We've got a team working in the background that's organizing all of our questions so that
Okay.
then we'll make sure we're going to do our best to sort of provide some comprehensive answers. So thank you, Susie, for going first.
That's it.
Appreciate you're willing to jump in there. Kelly, I believe, Kelly, you're the next raise hand on my, oh, sorry, no, Jean Walker. My apologies. Jean, you're next on my list if you'd like to come off of mute.
Hi, I have a question. The video that you just showed spoke about housing first and how studies show that housing first works better than other programming. I disagree with that, and I think there are a lot of studies that show something different, and it's irresponsible for the city to say that only housing first works best. Is there any response to that? Is there any reason why we can't use both? And I would also argue that La Posada is an organization that requires people to be clean and sober in order to be a client there. They're moving to a low barrier platform, which I understand what a low barrier platform is. It's very different from what they have now, and there's no reason to be doing that. There is a very long history in Carlsbad of Carlsbad's residents being very supportive of La Posada because it requires that kind of buy-in. And I say that, and I do realize that Leila Panagidis is the executive director of that, or excuse me, I'm not the executive director, the president of that organization, and that you are on this Zoom. And I appreciate you being here.
Thank you, Jean. And again, team is, so heard a couple of things in your comments. They're both related to questions like, how come the city has chosen to do this? Because there are other studies that show things differently. So looking for, a bit more background, bit more context. So thank you, Jean, for both the questions and the comments. We'll make sure that we've recorded those, and we will come back to them.
My question was more not so much that. My question is, why would you put that in a video here?
Okay.
Because it's an irresponsible statement to say that this is the only way to go. It's not the only way to go. There are other studies who show something different. You have to, as a governmental entity, you have to show both sides of it.
Okay. Yeah. Thank you, Jean. No, thank you, and appreciate the clarification. That helps the team make sure that they respond accordingly. Thank you, Jean. Kelly, you are the next person that I see a raised hand. Kelly, feel free to jump in here.
I think perhaps that's me, Kelly Dennehy.
Sorry, Kelly Dennehy. Yes, I didn't. My apologies. Yes, go ahead.
Okay. All right. First of all, thank you for having this meeting. And I just want to express that I am a woman of strong faith and concern for others. But I live in a community, quite frankly, that's been under a lot of stresses due to crime and homelessness lately. I live near Avenue Encinas and Poinsettia. And we did have a meeting with the pro tem mayor, Blackburn, I think that's his name, about the homelessness situation, and in particular RV parking for homelessness along our street. We've seen an increase in crime. We've had our children approached by strangers asking where they live and if their parents are home. We've had people had things stolen from their homes. And we see an increase in panhandling at the Ralph's grocery store and just in general along the area. So as the city thinks of this Housing First program and potentially housing homeless in the motels along the Avenue Encinas, we are very concerned in our community for our children. We have 200 homes. We basically are pretty much considered a school because there's so many children here. And should any of these hotels be targeted for this program, we are concerned and want to know more about how they're going to protect the citizens that live in the area and the children, because we have to balance homelessness with the children too. As adults, we understand homelessness, but our children don't, and we don't want to cause stress and anxiety in our youth. So I just wanted to express those concerns and make sure that the city is thinking very clearly about that, because things like homelessness and people dumping their sewage in our gardens and having it smell like urine is really, really bringing down our home values. and we've strived, and our quality of life, and we've strived so hard to do the right thing, to follow the rules, and to live in this community. And now we're seeing we have a police scanner in our community watching the Motel 6. It's really upsetting for the children and our community. So as we figure out a homeless solution, maybe there's better areas that are further away from neighborhoods, and where we can find like open RV lots or something else. But I commend you on your job. It's a big project, but just please be aware that there's a lot of concern about the Avenue and Encinitas area.
Thank you, Kelly, for your stories. Thank you for sharing some of those experiences. Again, really important to understand what's out there, what's happening, and what citizens are really wanting the city to be thinking about, and what are concerns. So thank you, Kelly, for that. Anthony Bona, I believe you might be next on my list. Coming over to you. And one more time, Anthony, you might be muted.
Sorry.
Now give it another go.
How's that?
Sounds great.
Better?
Yeah.
Thank you so much. These are kind of follow-up questions for some of the previous folks. Why the Housing First model? It's in my experiences and my research, it's a flawed model. I understand HUD funding. I get it. But why do we have to follow the money? Why can't we think outside the box? Why can't we get creative? That's one. Two, and this is kind of around what Kelly said. I was also at that same meeting with Councilmember Blackburn. There were a lot of kids in that neighborhood, and it really disturbed me that both the police, Priya Patel and Councilmember Blackburn all said that at least it was my understanding, there would be no background checks done on people who are going to go into these hotel voucher programs. I'm going to take a page out of Teresa Acosta's playbook, where she likes to give her resume anytime there's a vote on the dais. I'm going to tell you my background. I worked on Megan's Law. I'm one of the original developers of Megan's Law. And I have a soft spot in my heart in protecting children and other folks who could be subjected to violence of homeless predators. So why can't we do a background check on these people? I mean, what prohibits us from doing a Megan's Law background check? There's a lot of vulnerable children out there, and it seems like the perfect storm is brewing for something bad to happen. I mean, I'd hate to see that. Like I said, my background is being one of the original developers of Megan's Law. I think we should do the best we can to protect the children. Thank you very much for your time.
Thank you, Anthony. Appreciate your comments and your questions. Let me do a check-in, everyone. We've just other people maybe who haven't raised their hands yet. Again, I know that there are questions and comments coming in the chat, everyone. So we are seeing those ones that are coming in there too, but did just want to do a quick check-in with any others that wanted to come off of mute, pose a question. Leela, I see you. I'll just wait one more moment just in case if there's anyone else who's coming in here again. Continue to feel free to jump in. Leela, I am turning it over to you.
Yes, thank you. Thank you. Yes, my name is Leela Panagidis, and one of my volunteer roles is the president of Friends of La Posada. And we are an all volunteer nonprofit here in North County. And we do this through education, through advocacy and fundraising to support the shelters and also mental health resources for people. I think it would be helpful just to comment to the city staff and really thank you for all of your efforts and your collaboration throughout these years, is putting information out there that is evidence-based, that's factual. as I started my journey in this role and learning about the homeless situation, not just in California, but across this nation, I had to dispel a lot of myths and misconceptions that I had of the population of people who find themselves unsheltered, which could be really any of us or people that we know. And so looking at this from compassion and empathy, but also from really understanding the facts and getting the facts out there is important to people having a common understanding of the reasons for homelessness, but also prevention. I think if we're focusing on prevention and what we can do to avoid the situation in the first place would be helpful. So thank you so much. And I have a question for for Carlsbad PD in terms of crime, whether you see an uptick in crime or what are some of the connections between crime and homelessness. My understanding is that some of the low budget hotels that run as a hotel actually have high crime or higher crime. And then when they are converted to, let's say, a recuperative care center, it lowers the crime because they have staff on site, they have support services. And so it actually deters crime from happening when you convert, let's say, a motel into a recuperative care center. So if you can address that, I would appreciate it. Thank you.
Thanks, Leila. Now I'm just going to check in. I believe Ellie, it might have been Arkins. I apologize if I've said your last name incorrectly. I had saw a raised hand and then it might have come down. So I just wanted to do a quick check-in to see Ellie, I believe was the first name, if you wanted to share anything here. I'll just give that person a moment to unmute if needed. Okay. All right, so let me do one more call to those of you that are listening in here. Again, any other additional questions or comments that you would like to offer sort of in this open platform. And then once we're done in this space, I see lots of questions are being typed up here. We'll do our best to see what we can address there. So again, just going to do an additional call for any questions, extra comments. I see a couple coming in. Angela Townsend, I think that you were first on my list. Over to you.
Thank you. Can you hear me?
We sure can.
Great. I was curious, well, homelessness doesn't know boundaries. It crosses city lines. And I'd be interested in finding out more about what coordination you have with our surrounding cities in order to either prevent homelessness or address homelessness, and also any agencies that help cross the borders too.
Thanks for your question, Angela. Absolutely. Our team will make sure that we're recording that as well. I also see Jen Belknap. I believe that your hand was raised. I'm going to turn it over to you.
Hi. I just wondered, are there any rules that the city has established that prevent homeless housing or services from being in a vicinity where children dwell? For example, the Waters End community, they were just discussing that, whether it's communities or neighborhoods, or schools or parks.
Okay. Yeah. Thank you for your question, Jen. Again, we'll make sure that we record that so that we can come back and provide some responses to that here later in the call. Now, I am also just going to do one quick check-in. I do see a couple of people who have joined us here by phone. And I know that when you're joining by phone, there's not quite as many features and tools. So those of you that are on the phone, I'm just going to do a quick check-in. I'm going to give the last 3 digits of your phone number just to see if there was any questions or comments that you wanted to offer. So I do have a person whose phone number ends in 553. Just curious if there was anything that you wanted to share with us. Again, that number that ends in 553. And *6 is what you're looking for to come off of mute. And I'm also going to check in with, I have another phone caller whose phone number ends in 099. Again, if there was any comments or questions, you can press *6 to unmute yourself. Again, that's phone caller ending in 099. Okay, I'm not hearing anything from the floor. Okay, everyone, so here's what we're going to do. Again, if additional questions come up, again, feel free to continue to go ahead and use that raise hand feature, but did want to give an opportunity for some of our team members to address some of those questions or provide a bit of additional information. So just give me a moment here, everyone, while I am coming into, I've been keeping track of some of the questions here. So maybe let's start with this first one, because a few participants had made reference to this. People were curious about why is the city using housing first approach, or like what's the importance, or what's the research or thoughts that have gone behind that. So I'm going to, Holly, David, this might be a combination of the both of you sort of sharing a little bit on this. So maybe Holly, I'm going to put it over to you first, and then I can check in with David afterwards.
Thank you, Kim, and thank you for the question, everyone. I really appreciate it. Housing First is a best practice evidence-based model in the field of homelessness, and it's been around since the 1990s. In fact, there was a very important study in New York called the Pathway Studies, and also here in San Diego, essentially where basically the traditional model was treatment first. And this changes the paradigm, where instead of waiting for somebody to be housing ready, the idea is trying to help somebody meet their basic needs first. It was signed into California law under the governor in 2016 under Senate Bill 1380. And basically there was overwhelming evidence that showed that Housing First reduced emergency room costs and people could be very successful. There are numerous studies, and the VA, which is one of the largest federal agencies, serves over 85,000 individuals with supportive housing, also adopts and uses the Housing First model. So there are lots of very reputable studies, and homeless service providers, both here in San Diego, the Regional Task Force on the Homeless, which is our local continuum of care, all the way up to the state, to HUD, National Alliance Ending Homelessness. This is a referenced evidence-based practice that is adhered to, and that's why we referenced it in the video, because we do, although there are many ways to support people in addressing their homelessness, we do want to get sound methods here in Carlsbad, and we really want to serve our population. And we know that our population struggles with certain barriers with substance abuse and mental health, and we really want to meet them where they're at and provide these resources.
Thank you, Holly. David, just checking anything that you wanted to add in, or sort of add extra information to what Holly had shared.
Kim, I think Holly covered it quite well. Thank you.
Okay, thank you. Holly, I have a couple more questions for you here that thought might people had also talked about. There was a question here related to people had talked about that maybe this is like a flawed model, or like this, maybe isn't the one that we really should be looking at, or has, significant drawbacks. Maybe if you could sort of address some of the concerns or the thoughts behind different models, and which is the one that's appropriate for Carlsbad to be using.
And I think with people, we try to individualize their care, so there's not like a one size fits all. So if somebody does want to get into a program and work on sobriety, mental health, we are very much supportive of that, and we are going to get them connected to different resources. What we're saying is that we're not going to mandate them to address those issues first before they can access housing. So I know somebody had asked, do we refer to Solutions for Change? Absolutely. We want to help people get access to whatever resources make the most sense for them. And we know that homelessness, there's lots of different ways for people to address that. And so we want to do what makes the most sense for the individual. Just in these programs, we are going to be using the Housing First model for our program.
Thanks, Holly. Now, everyone, I'm going to get Holly to answer just a couple of other questions here too. But because we certainly still have some time here. If there's sort of any extra questions or additional comments that come up, again, please feel free to find that raised hand feature, and we can mix in a few of those. Holly, there were some questions specifically related to the voucher program that the city is looking at using. So there was a question here related to how would you choose these hotel locations? Like tell us a little bit more about how that works.
Yeah, so we're in the process of working with a service provider, and there are different hotels that we are having active discussions with. There is a checklist where we are trying to go by, obviously trying to find a location that's accessible near public transportation, that's pet friendly, that would allow for long-term stays, that would allow ADA rooms and compliance. And so there's lots of different things that we are going to look at in that sense. And we are being mindful of the location and trying to be thoughtful in where we place it in the location. So we did have not us, but the county did have an at-risk hotel in the city of Carlsbad that was able to operate with minimal issues for 5 months, and had really great outcomes. And so we're hopeful that our program can be equally as successful, and we certainly are going to work really hard and try to be really, really intentional with the design.
Thanks, Holly. Now I'm going to give a bit of a follow-up question to the one that you just answered. People had asked this earlier. They had talked about, so you talked about some programs had already been running and had some success. Maybe just give a bit of information, like where are the programs running? How were those, or why were those locations chosen? I know you've touched on it a little bit, but just wanted to make sure that we address the question specifically. So I guess, where are you operating these various programs, and how were those, or why were those locations chosen?
Yeah, so we currently do not have, our voucher program is not up and running yet. So we do not have that program established. We hope to go to council in June, and we hope the program to be up and running in late June, possibly July. And so those hotels we're still having negotiations with. So there isn't anything specific to report at this time.
Okay. There also were some questions, Holly, related to how would people be screened, or what sort of background checks, essentially maybe tell us a bit more about how people get into those programs. Maybe tell us a bit about that.
Yeah, so we're going to accept referrals from our homeless outreach team, self-referrals, and then from our nonprofit providers. We obviously have invested in a lot of different resources, so we are going to try to support as many different access points as possible, city staff. And we also will be some of the criteria will be, are they experiencing homelessness in Carlsbad? And then we will be doing an additional follow-up with verification. That could be looking into our homeless management information system, looking at if they have a PO box, bank statement, if they're working here, and also just known to our homeless outreach team, and other kind of ways to verify. But again, using the Housing First model, we won't be doing background checks before people will be going into the program, and we won't be requiring those types of checks before we enter. If they are registered with Megan's Law, then that will be something that, of course, they will be responsible for informing and sharing that stuff, and we will make sure that they're compliant, and our social workers will be working with them, and we'll have behavioral health therapists. We will have security on site, providing coverage. And again, if there's any concerns or if there's any safety concerns, then we, they will be, exited from the program if there's any kind of violations of that sort.
Thanks so much, Holly. All right, Holly, I'm going to give you a little bit of a rest right now. Mickey, it's your turn. It's your turn to answer a few questions here. So, Mickey, a couple people were curious about what's the city doing to address crime at motels in general, or potentially when the city is to move forward with a voucher program, sort of how does Carlsbad PD integrate with that? Tell us a little bit more about that.
Sure. So for those, my name is Mickey Williams, obviously, and I've been with the police department for 26 years, and I've seen, and a lot of the comments that were made kind of resonate with me, both as a police officer being in the community for the 26 years, but also as a resident and raising my two daughters in this same city. I've experienced some of the concerns that were discussed. So I kind of see this from both the police perspective and also the resident perspective, being both. As it relates to how we address the crime issue, several years ago, we implemented what's called CARS, or the Crime Analysis and Response Program. And so what that does is we have 2 full-time crime analysts that monitor all crime reports, trends within the city, within the county, and within Southern California. And each lieutenant within our police department is responsible for a division and specific aspects of crime, whether it's patrol in a certain area or a certain type of investigation. And so what happens is we, every week on Wednesdays, have our 2 crime analysts brief our lieutenants who are responsible to operationalize crime response activities. And they meet as a group every week to come up with plans on how to address what is happening that we're seeing every day. And so when we talk about how we address crimes around hotels, it's the same as we address crime in any neighborhood. What we do is we try to see and identify quickly where there is a spike in crime and where we're having reports of certain types of activity more than others, so that we can more intelligently locate and place our officers. We then overlay that with our, we have a patrol division that responds to 911 calls and that sort of thing, and calls for service. We also have a team that is specially set aside to do proactive enforcement. So when we get calls, for example, there was a reference to the hotel area near Avenida and Encinas recently. That has been one of the programs of our proactive response team that deploys cameras, that deploys unmarked vehicles, increases patrols, works with allied agencies. We cooperate daily with the Sheriff's Department and with Oceanside Police Department and other agencies to try to address these crime issues that we see spike that come through the crime analysis program. But I would say 2 things that I think are really important for this discussion. First, when we do focus, and we being law enforcement, when we focus on crime issues, it results in more police activity in the neighborhood, because you're going to have more police officers, you're going to have more traffic stops. Trying to sort out, trying to catch maybe a person that may be stealing something or something to that effect, results in other type of police activity. And sometimes, though we are reducing crime by our activities, and it actually reduces the danger of being victimized because of the presence of law enforcement, it can be perceived as more dangerous because there's just seems to be more going on. And I think some of that, and that's just a piece of this, obviously, but in 2019, we saw a reduction in crime in Carlsbad. We saw a 5% reduction in violent crime, a 12% reduction in Part 1 property crime, and we saw an overall crime reduction of 11% of Part 1 crime in Carlsbad. But I can understand that in neighborhoods that are seeing police officers, that are seeing traffic stops, that are experiencing crime, it may not feel that way. And so we're really trying to balance and work with being very responsive and addressing and trying to prevent crime by being responsive to the data, but at the same time, realizing the effect sometimes that may have on the perception of safety. And that's one point I think that just has to be considered. And then secondarily, there's the issue of crime and the feeling of safety. And then there's also the issue of homelessness, and they don't always match up and aren't always the same. So for example, many of the incidents around and specifically the area along Avenida Encinas that the neighborhood is aware of, and the crimes that they have reported, many of those are not related to homelessness. They're related to other type of criminal activity, but sometimes there's this overlapping of the issues, and I think that we just have to be very clear and careful in how we assess and respond to these type of situations, whether from a homeless response perspective or a crime prevention perspective, because they're not necessarily the same in each situation. And I think those are just some issues, some pieces of information that we kind of need to really carefully sift through when we say it's a homeless problem, when maybe if we address it as a homeless problem, but it in fact is a criminal issue that isn't necessarily homeless related, we may miss the solution, and vice versa.
Thanks, Mickey. Mickey, do you have another who are residents of Carlsbad, or sort of, you know, anybody who has become homeless or sort of has come to the area? So people just curious about like who gets to access these programs and how is that determined?
Yeah, well, again, what we've found is that about 70% of individuals here in Carlsbad, their last permanent address was here in Carlsbad. A lot of folks have grown up in Carlsbad and have ties to the community. And so, you know, this will be a program serving Carlsbad residents experiencing homelessness. And so our neighboring cities in Oceanside and also Encinitas are running hotel voucher programs right now as well. And so, you know, we definitely, you know, again, there are going to be folks that, you know, we can direct over there, but that's not, you know, our intention is to serve our residents here. And again, we're our homeless outreach team knows those folks very well, and again, our housing navigator who will be making referrals, as well as our nonprofit faith providers, and so we hope to serve, you know, our local residents.
Thanks, Holly. And just one follow-up question. There was a few people who were sharing or curious, Holly, what kind of links or resources, like things that we could point people to as far as like the studies that Carlsbad is using to inform its approach. Just wondering, you know, what might we be able to post or what might be able to share? Lots of people are looking for, like, I just want to learn more and, you know, understand what's out there.
Sure. And so, I mean, there's a couple different studies, and so again, specifically around the Housing First, there was a very famous study that was done in Canada with over 2,000 participants, those who had serious mental illness, as well as those who had a co-occurring disorder with substance use. And it was called the At Home Chez Soi study. And what they found was individuals were randomized between the Housing First model, which again provided like ACT level intensive case management and a housing voucher program, and then treatment as usual, which again was case management services, and then connection to like group homes or boarding cares and different types of levels of treatment. And they followed these participants and outpatient behavioral health services. And they followed these residents for, or these individuals for over 2 years. And what they found was there was a significant decrease in symptoms, and individuals who were able to be in the Housing First model actually maintained their housing and were more successful than those who were in the treatment as usual. And interestingly, there was just a study that was recently published in a journal in this year that looked at these same participants at a 5-year follow-up, and 70% of the Housing First clients were able to maintain their housing and had a better quality of life, and were able to live successfully independently. And so we're hopeful that those are 2 studies, and we're happy to post those online. We are developing a very robust FAQ. And so if that's important to the community, we certainly want to be able to provide those resources and that evidence to support that.
Thank you. Thank you for that. Anthony, I see your raised hand. How about we just jump over to you for a moment, and then I'm going to jump back into some of my questions. Go ahead, Anthony.
It's almost the end of the meeting. I'll get this down one of these days. Thank you so much for facilitating. I have a couple of questions, comments. One is Ms. Nelson made reference to an HMIS, a homeless management information system. I'm not aware of any HMIS that the city of Carlsbad paid for. I study very acutely council meetings, and like I said, I'm not aware of an HMIS that the city of Carlsbad ever sponsored. I would like a response on that too. Ms. Nelson made reference to serving residents of Carlsbad. We had a project here that is presently being built called Windsor Point. It started out as a shelter for veterans, and then we as residents discovered that the funding was not going to go through and it would get pulled. So it needed to be broadened to people with severe mental illness, which I'm not for since it's by parks and schools, but whatever. The question is, wouldn't it be discriminatory to only serve homeless people from Carlsbad? Third, Mayor Hall, since you're on this call, this is directly to you. I would ask that you immediately pull funding from La Posada, since they are relaxing their rules, and it's not what we signed up for. So those are my comments. Thank you.
Thanks, Anthony. Appreciate those comments. Everyone, I've got a couple of more questions that I'd like to go through on the list. Do know that as we come to the close of our time together here, we do have we have one last question that we'd like to ask everyone. And so I'm going to share with you the question right now, just so that you can reflect on it a little bit and consider it as you're listening to the responses to the last few questions. We are curious, before we leave the session tonight, for you to share with us in the chat box if you had a final piece of advice, or here's my to Holly and the many others that are going to be working to implement many of these programs. What's your sort of best piece of advice, or your guidance, or the insight that you would like to offer the team as they move forward? So know that that's there. Know that I want you to be thinking about that. But there are a few more questions that we've got some time for here, and we'd like to address. So let me just check in on a couple of them here. Holly, there also was a question here related to how does the city work with other agencies? How do they work in with the council? Sort of what are the roles, and where are they the same, and where are they different from one another? So maybe if you can speak to that.
Yeah, so it's really important. I came from with a nonprofit background of just really kind of pulling people together. And during the pandemic, one thing that was really clear was just the importance of partnership and communication. And so we have very, very, very strong relationships with all of the nonprofit agencies here. So we work with Interfaith, we work with La Posada, we work with Community Resource Center. We work with lots of different faith-based organizations, grassroots organizations that are serving our homeless community. We also work really closely with other cities and jurisdictions. So it was important when I started to kind of pull city staff together to have conversations regarding what are you doing within your city? And as somebody new to city government, I wanted to kind of learn from them and to be able to hear you know, just kind of what we were doing and get on the same page. And so we do have a regular meeting where we meet on a monthly basis and discuss homeless issues. That's also been occurring at the elected leader level as well. And so there's definitely those conversations. And we also have regular conversations with the county, as well as the regional task force on the homeless, which is putting out best practice guidelines and who again oversees a lot of the programs. I know it was brought up before. They oversee our homeless management information system that is throughout our county. They also oversee the point in time count and all the HUD funding, all the HAP funding. So again, any state funding that's coming down, they oversee that as well. So yeah, we try to really maintain strong partnerships as well as with our city team members as well. So yeah.
Thanks, Holly. And I've got one more here for you, Holly, and then Nikki, I might just jump back to you here in a moment. Holly, I think we might have somewhere along the way created a bit of confusion related to, I'm just making sure I'm checking I'm just going back to some of my questions here, just related to Motel 6 and whether or not the city's operating a program there. So maybe if you could just go back and clarify sort of what's happening or planned, just there was a little bit of confusion in the chat. So just wanted you to have a chance to go back and address that.
Yeah, and happy to clarify. So we currently do not have any hotel programs here in the city of that are being operated by the city of Carlsbad. So so there are no hotel programs. We don't have our contracts established with any hotel vendors. And so that's just something that yeah, within our city.
Thank you, Holly. All right, Nikki, I do have another question here for you. This is a bit of a broad question, but people were curious about how is Carlsbad PD addressing concerns of homeless people causing negative neighborhood impacts? So maybe just speaking a bit to how your teams are working to reduce those negative impacts.
Sure. So I saw in the chat the reference to quality of life issues, I believe. And I think that that's where when we talk about crime statistics or crime issues, and then we talk about homelessness, it doesn't quite feel right, because if we say the crime is down 11%, but I don't feel safe, that those don't seem to match. And so I think what the question you just asked is related more to quality of life related issues. And those are really challenging policing issues in California. We've had a decade of significant criminal justice reform from AB 109, which was the realignment of our jails and prison systems back in 2011. In 2014, we had Prop 47 passed, which reduced the criminal aspects of many drug possession offenses. It also reduced the severity of theft related crimes and shoplifting related crimes. And a lot of those type of issues, the drug addiction issues, the petty theft, the shoplifting, those are a lot of what we have reported to us being related to quality of life related issues. And so with some of these changes, we're really trying to figure out where is the law enforcement leverage to fix this. And it's a challenge that each police department in California is facing, and we're talking about on a regular basis. One of the strategies we're going to use, and we are using here with the police department as it relates to the homelessness related issue, is with the additional officers, having them assigned and that were approved by council. So now we'll have 6 homeless outreach officers and 2 sergeants providing 7-day-a-week coverage our goal and strategy is to try to, using our data analysis, know where the calls for service are, maybe first thing in the morning. What businesses are more frequently being are reporting to us issues related to people that maybe they maybe classify as they don't want them in front of their business or something to that effect. And we're going to deploy our officers ahead of those calls for service and try to get ahead of them to initiate contact, to try to provide opportunity for outreach and to connect those people to services, but also at the same time to address the concerns of the residents or the businesses that are in those areas to hopefully prevent them from having to call us for a call for service. So that's really one of the proactive approaches we're going to try to take with this new, with the new resources in HOT, is to try to be more proactive to address the quality of life issues before the calls for service are generated by the community. And that's one of our main goals moving forward.
Thanks, Mickey. Everyone, a couple more questions here that we've got a bit of time for. Holly, I'm going to come back over to you. We certainly heard from people when we asked our very first question in the chat about what did people know for certain, and lots of people were making reference to, well, we know that it's increasing. We know that we're seeing and experiencing more. So wondering if you could maybe speak a bit to how many people do we know are experiencing homelessness in Carlsbad? Maybe talk about, is the number increasing, and what do we know about why that number might be increasing? So over to you, Holly.
So there's a couple ways we measure people experiencing homelessness, and this is a difficult population to count. And so the first thing is we use the point in time count, which is an annual count that's done throughout the country. And that's done in January. And individuals go out in teams to kind of count those that are sleeping on the streets and interviewing them and sleeping in the shelters. And that data is compiled at the city level, the county level, state level, and national level. And that usually is a reliable measure that people say is used and looked at. Since we are very lucky and fortunate that the city and residents have invested in a homeless outreach team, we've been able to kind of collect data every single day of how many interactions that we've had. So through that information, we have found that in last calendar year, in 2020, we had over 500 contacts with individuals experiencing homelessness in the city of Carlsbad. And so that number, probably does not represent everybody who's experiencing homelessness, because again, not everyone comes in contact with our homeless outreach team. There are folks that, maybe don't interact, but we do feel that, we do feel confident with that, with that number. And so, but we are trying to get better with our data collection. And we are, continuing to do counts and continuing to try to measure that information. And as far as the numbers increasing, we see a lot of people, even though we try to place people into housing, we see a lot of people entering into the homeless system of care for the first time. And I think with the pandemic, we've seen a lot of people lose their jobs. And even though we have the eviction moratoriums in place, a lot of people have been evicted during this time. And so experts do predict that homelessness will increase. And so we are trying to do the best to target the funding and preventive funds to those that are extremely at risk. We do look at that through different factors, like those that are paying more than 50% of their income to their rent. We look at those that are especially vulnerable, who are on fixed incomes, where again, one bill may cause them to not have that safety net and lose their housing. And so we are trying to look at that and trying to put certain programs in place. And we do have certain resources like that. But definitely there has been, in California, there's definitely been an increase. And I think a lot of folks too have seen more of a visible presence of people experiencing homelessness because many cities and Caltrans have been following the CDC guidelines, where we have not been cleaning up encampments due to the public health and safety. And so there's just been more of a visual presence of those experiencing homelessness during this past year.
Yeah, Thank you, Holly. I've got a couple more here for you. Again, some people were asking questions about what do we know, or what does the city know about those people that are experiencing homelessness, how they might be connected to, or may have mental health issues or substance abuse issues. What do we know about the numbers and the connection between those two things?
Yeah, so from the data, what we're seeing is about 58% report that they have some sort of identifying disability. And that, in breaking that down, we've looked at, and this is through San Diego County, and this is from 2020 data. So it does encompass city of Carlsbad information, but what we see is about 30% or 37% identify that they have a mental health disability. 31% identify that they have a substance use disorder. And then we see about 32% identify that they have chronic health conditions. And then 35% say that they have a physical disability. And so we know that people who are homeless do experience, again, usually a combination of these things. And usually because of just, living on the streets, their life expectancy is usually cut by 20 to 25 years compared to the general public.
Okay, thanks, Holly. And then maybe just our last couple questions here. Holly, what about people who don't want services, or don't, choose not to take the services, or don't want to get help? What does the city do in situations like that?
In my experience, as somebody who's done homeless outreach, for a very long time, and have engaged with a lot of individuals with serious mental illness, as well as those who've been chronically homeless for a very long time in the streets. I think it's about starting slow and building relationships, and really kind of putting yourself in kind of thinking about their shoes. If somebody came up to you and you were on the streets, you may not say yes if somebody's offering you something day one, and it's going to take a little bit of time to build that trust. You'll want to see if they're reliable, or are they going to show up. And these folks also have had a lot of disappointment with different relationships. People have let them down, and so I think sometimes it takes a little bit longer to get them going, and also to sometimes, again, trying to find the right resources. And that's why, by bringing the hotel voucher program here to Carlsbad, what we've seen during the pandemic is that throughout the state of California, people who have never have accessed resources before have come indoors for the first time. And so we're hopeful that we can serve those folks that have been really hard to reach, and hopefully get them connected to resources to help them to make those changes.
Thank you. All right, everyone. So we've covered many of the questions. We know that there were others that came in the chat, or that people might have asked slightly differently. So we're going to do our best to gather those comments, to gather those questions, pull together responses to as many of those as we possibly can. Anthony, I do see your hand. Just give me a quick moment, everyone. I want to tell you a little bit about where to from here. I also wanted to make those of you that have been giving your final pieces of advice in the chat. Margaret, if we could just bring up that screen share. I verbally gave the question, but do want to make sure that there are people have a chance to see that question as well. So everyone, just give a moment here while Margaret brings that up for me. So question that we wanted to pose to all of you, what's your final piece of advice, or what's the last insight that you would like to share with us? Now, I want to be careful, everyone, on the word final. Final for today. Obviously, our meeting's coming to an end, but obviously this is going to be an ongoing work. Holly, in a moment, I'm just going to invite you to share a bit about, I know, some of the ways that your team is available for questions and those sorts of things. So I'm going to turn it over to you here in a moment for people that may want to follow up in the future. So everyone, just know this is the question here. We've got many responses in the chat, but please feel free if there's anything additional you'd like to share. Please put that in the chat. So Margaret, go ahead and you can close that. And so Holly, last two questions for you here. There was people who were curious about, like, if I wanted to volunteer or if I wanted to get involved, like, how can I do that? And then maybe just a bit on if people wanted to follow up in the future, what are opportunities to do that?
Mm-hmm. So right now, we definitely, as far as getting involved, we certainly want to support people in doing that. There are definitely different organizations here in Carlsbad that serve individuals experiencing homelessness, and so we have a list that's developed, and we're happy to put that on our website or email that to the group. Also, we do facilitate an annual point in time count, so individuals can get involved in that way. And we are going to be looking for more opportunities where individuals can help out, because we really want to help the community feel empowered and to kind of get involved at that level. And just to learn more about the issue. So we really appreciate the question. So that is one way. And then as far as still staying engaged, we are trying to really bring more information to you. So we will be coming up to council on a quarterly basis, providing information around statistics and updates regarding our program, and that will be shared. We also have a homeless action subcommittee that will be meeting monthly. So that's something that will be live streamed and individuals can check in. We had our first meeting yesterday, so you can go onto the city's website and listen to that. Individuals can provide public comment. So that's another way to kind of stay informed, as well as sign up for emails, checking our city website. And also we are trying to facilitate regular office hours where it's more of an intimate setting where we can have more of a conversation and dialogue. Usually those are less than 10 people, and we can really get more into the meat of things regarding the discussion. So yeah, thanks.
Thanks, Holly. All right, Anthony, last comment, and then everyone, I'm going to tell you the next steps, and then we will come to the end of our time together. So Anthony, last comment.
Thanks. See how much quicker I was that time, Kim?
Excellent. Well done.
Thank you. I think I mentioned in a previous dialogue that I had tonight, my background is data analytics, Holly Nelson. And I'm curious really to break down the numbers. If our budget, say for instance, is, I'm going to grab a number and say $13 million a year. And you, I think, said earlier that we served 500, we had 500 contacts of homeless people. Is it as simple as dividing one number into the other? I really think that it's, the city labored over goals workshop, right? They had many different workshops from January to now. And one of their big targets was homeless. And I would like to know, and I think every constituent in the city would like to know, what does it cost per homeless person? I would like to know the cost per head. And then that would give me some insight whether to give the thumbs up or the thumbs down on continuing. Maybe it's not that simple. I'm just a data guy, right? And I try to simplify things into boxes. But I would look to your guidance. Secondly, and I didn't want to forget, and I'm glad I didn't, Holly, you're doing a stellar job. Thank you. Mickey, thank you very much also. For representing in the city, and the rest of the city staff. You've all done an outstanding job. And I hope you don't take my questions as anything other than just a curious regular guy. That's it. I'll turn it back to you, Kim. Thank you.
Thanks, Anthony. And we appreciate the feedback. So everyone, let me tell you about what comes to what happens from here. Again, just a really huge your time. We appreciate your willingness to listen. We also very much appreciate all of the comments and feedback that is coming in, both verbally from all of you who were speaking, as well as those of you that were participating in the chat. We know this is a complex issue with a lot of impacts and a lot of different perspectives. So again, we appreciate your participation this evening. We also are going to encourage you in the chat, everyone, there's going to be a website. Soon you are going to see an online survey that is going to come on the website that you're going to see our project webpage. We encourage you to take that survey. We encourage you to share it with others. And please know that this feedback, as well as the other sessions that are being hosted over the coming weeks, will be compiled and it will be shared back with the City Council Homeless Action Subcommittee on June 28th, everyone. So know that this conversation is going into the city and will be reported back to that action committee. And we encourage you to stay involved, stay engaged. Again, we very much appreciate all of you being here with us tonight. And I'm just going to check in with my team members. Mickey, Holly, anything that I've missed before we bid everyone a good evening?
I would just like to add one thing, what people can do to help us. As I had talked about, both from the crime perspective and also the homeless response perspective, we look at data, which are calls for service, reported incidents, that sort of thing. It's very, very important to call us and tell us what your observations are. If you've been a victim of a crime, and even if you feel it's minor, please call us so that we can be aware of it, because it will be discussed in the next Wednesday meeting with the lieutenants. And then secondarily, with the homeless, if you're dealing with a homelessness related issue, please make sure that you're advising the police so that we're aware of it and we can adjust our response accordingly. The information we get from the public is how we derive our response. So thank you for being here, and please don't be afraid to give the police department a call. We're here to help you.
Thank you very much. Holly, any final words from you? And then we are going to bid everyone good evening.
Wanted to thank everyone for your comments and questions tonight. I know that we all bring a unique set of backgrounds and experiences here, and we certainly want to, come up with a solution together that works for everyone. And at the end of the day, we all love Carlsbad and we all want to bring a good quality of life for everybody. And again, we're all trying to do this together. And so thank you for taking the time out of your day to participate in this conversation. And I hope that we can continue this in future spaces. So thank you.
Yeah. And Mayor Pro Tem Blackburn, I had meant to make sure that you had a moment to have some closing remarks as well. Over to you.
Well, some of the things I've heard from people, not just in this meeting, is we're throwing money at the problem. The best answer I can give is we're trying our best, and it is going to cost money. But if we do nothing, for sure, the problem won't go away. So we're doing the best we can. Is it going to work? We don't know for sure, but we really are trying, and we really are investigating the best process. So thank you to everybody who took time out of their night away from their families to try to help us with this.
Excellent. All right, everyone, stay well, look after yourselves until the next time we have the opportunity to come together. Again, very much a thank you from all of us, and have a good evening, everyone. Take care.